Caroline Jones.
Cabinet Secretary, October is Breast Cancer Awareness Month, and to mark the occasion, Breast Cancer Now have published a new report looking at the breast cancer patient pathway and makes recommendations to improve patient outcomes. We are now making progress in improving breast cancer survival rates. Both 1- and 5-year survival rates have increased by 1.7% over the last decade. We are getting better at detecting breast cancer, but we are not always treating the cancer early enough. Referral to treatment cancer targets for both urgent and non-urgent routes have not been met in the last 12 months. Breast Cancer Now are calling for you to closely monitor performance against waiting times and to take remedial action. Cabinet Secretary, will you accept this recommendation and outline the steps that you are taking to meet referral to treatment targets?
Thank you, Member, for the question. This is an issue where there is a genuine concern across the Chamber and within and outside political parties. Actually, the achievement in cancer services is a marker of the success we've had within the NHS, but also of the unmet challenge that still exists. I'm pleased that you noted there's been a significant move forward in 1-year and 5-year survivorship within Wales. We're statistically in the same place as the other 4 nations in the UK. We also see more people being referred in and more people treated and treated within time. And that's on the back of a 40% increase in referrals in the last 4 years. But the unavoidable truth is that within the United Kingdom, all 4 nations, we're still at the bottom end of the outcomes league table with other European nations. There's much more for us to do. Now, I don't accept everything that the Breast Cancer Now survey says, but when it comes to the need to try and do something about screening, because unfortunately the screening results on breast cancer have gone down, we're not having the same numbers of women come through. There's a challenge for us about making sure that the message is clearly understood, that early screening will help to save lives. Also about the challenges in our diagnostic capacity as well, and that is absolutely part of what we are looking to do, not just with immediate performance monies in this year, but on a longer term and sustainable basis. And I certainly do closely monitor performance. Referral to treatment and cancer are issues that every chair expects to have to discuss with me. And indeed, when services go backwards, then there is extra attention provided. A good example of this has been Cardiff and Vale Health Board. Not that long ago, against the 62-day target, there were figures in the 70%, wholly unacceptable. They've resolved and looked at those issues, and they're now in a much better place, and over 90%. The challenge for the rest of Wales is how to have the same level of understanding of their challenges and their achievement, and to do that on a sustainable basis in the face of ever-increasing demand.
Thank you for your answer, Cabinet Secretary. One of the biggest improvements we can make to breast cancer care, and the whole purpose of the Awareness Month, is to make the public aware of the signs and symptoms of breast cancer. Detecting breast cancer early improves your chances of survival, as I know from personal experience. I'm now my 10th year following breast cancer, and I owe my life to the fact that I noticed not a lump but a dent, and the excellent staff at Neathport Talbot Hospital gave me first-class care. Cabinet Secretary, breast cancer can present itself in many ways, so it is vital that the public are aware of the signs and symptoms. Many men don't realise that breast cancer can affect them. 54% of men in the UK have never checked themselves for symptoms. What plans does your government have to run public information campaigns on breast cancer targeting both men and women?
I'll check, but I'm not aware there is a particular Welsh Government plan to run a targeted campaign at men, but we do recognise that the third sector are particularly active in promoting awareness. I actually think that the biggest thing that we know, because there's evidence about this being an effective population screening basis, is actually to make sure that breast cancer screening service is taken up in higher numbers in the future. We do have a challenge with men and their awareness of breast cancer, and actually men generally in their own health awareness on a whole range of issues. There is a broader challenge about not just understanding if there is a problem, but I think the bigger gain to be made is actually in primary prevention and in understanding those behaviours through diet, exercise, alcohol and smoking, or we are more likely to become unwell, including to suffer a range of cancers, and to take more ownership and control of things we can do for ourselves.
Cabinet Secretary, we all know that prevention is better than cure. While we can and are taking action to tackle some of the risk factors associated with breast cancer now highlight the fact that we can't tackle the biggest risk factors, being a woman and getting older. We can, however, take action to reduce the risk of breast cancer spreading to other parts of the body. And Breast Cancer now are calling upon the Welsh Government to improve access to preventative medicines such as bisphosphonates. Cabinet Secretary, what is your government doing to improve access to off-patent medicines for Welsh breast cancer patients?
Interestingly, the member is in the room, but I had a meeting on exactly this subject about 6 weeks ago with the member for Torfaen and her parliamentary colleague. These are areas that we're actively considering to see there's more that we can do to have an evidence-led approach to making sure that the most effective and proportionate treatments are available within our service.
Tynwyd cwestiwn 3.